Prior to beginning the activity, please be sure to review the faculty information and disclosure statements, as well as the learning objectives. After listening to the activity, complete the post-test by clicking the Earn Credit link in the episode description. Downloadable slides and resources are also available. The following presentation is copyrighted by Medscape. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of Medscape.
It is the policy of Medscape Education to avoid the mention of brand names or specific manufacturers in accredited educational activities. However, trade and manufacturer names in this activity are provided in an effort to provide clarity. The use of brand or manufacturer names should not be viewed as an endorsement by Medscape of any specific product or manufacturer.
All right, this is the health risks of nicotine use, a focus on at-risk populations. I am Gabrielle Davis. I am the owner and sole counselor of Equitable Counseling and Consulting. I'm a respiratory therapist and a mental health therapist. All right. So first, let's talk about the at-risk populations. People of global majority, and those are Black and Brown people across the world, people that are housing insecure and may continue or have brief bouts of not having a home to go to, the LGBTQIA plus community, people with mental health conditions, folks with lower socioeconomic status, and youth and young adults. I stated youth and young adults last because this is really a population that we should all be focused on right now. And I would say the past decade or so, we've had a whole group or whole generation of people that may have not even considered smoking cigarettes because they think it's gross, because there has been 50 years um, of education, strategic marketing in a positive way to kind of push youth away from cigarettes. And now uh, with more opportunities to have nicotine products through vaping or smokeless tobacco or other products, we are still seeing a rise in youth using nicotine products. I took some stories here from um, clients I've seen or mentees I've had or places I've spoken when I've talked to youth about nicotine prevention. And here's some of what they had to say. It's not cigarettes, so it can't be that bad. And this teen believed that vaping isn't bad because it smells fruity, right? And that while he didn't vape, he was around it all the time and his parents were always mad. So he could not understand why his parents were upset, nor did they have the language to explain to them, to their child why it was bad, because they didn't know either. Right. And so there's a lot of that, where there's a lot of education readily available about cigarettes. Sometimes you have to dig. In addition to that, parents also don't have all the knowledge that they need to have in order to dissuade their children or provide the information they need about why it's bad, other than just saying it's bad. The teacher during the parent teacher conference brought up that kids discreetly bring vape pens tucked in water bottles, or there were a few tucked in coffee cups and backpacks. I also was able to get a watch, and it looked like a smartwatch, but it popped out and you could vape right through that. I even have a vape that looks like a albuterol inhaler. Right? You can find the instructions in many places about how to create your own devices. So it's important that we as healthcare clinicians have this knowledge too, but that this knowledge is provided to parents as well, so they can be, aware. Uh, at one point I did a presentation in school, and a teacher turned in a highlighter and a Sharpie that was exchanged. And so instead of having the insides be, whatever's inside a Sharpie or a highlighter, it was a vape device. And so, just being mindful of what's out there and sharing with the adults around you to support youth. I can't wait to try it. My brother says no, that it's bad for me, but he does it all the time, which means he just doesn't want to share, right? And so you have a older teen that is vaping, knows is bad, is able to differentiate, good from bad and what could be harmful, doesn't want, his brother to use it, but also doesn't want to stop. And so while the child is like, well, hey, my brother's being selfish, it's not really looking at it as the brother being protective or trying to stop him from using, um, uh, because neither of them have the language to explain to the other one about why it could be harmful. Some of the reason behind that is the intentional marketing around nicotine products. We know back in the 90s, there was actually uh, a marketing campaign called Project Scum. Scum stands for Subcultural Urban Marketing, that specifically targeted communities of color, the LGBTIA plus community, communities with lower socioeconomic status, and communities with mental health conditions. And there's tons of research about this, but this was in the 90s. I believe 1995 to be exact when this came out, and it was allowed, right? You can still see that the remnants of that. Maybe they're not using this particular plan or particular campaign, but the remnants from it is still impacting those very same communities. In for instance, Black and Brown communities, and a lot of other communities, especially those without grocery stores, there are lots of advertisements on the doors of convenience stores. Again, remembering that redlining impacted where groceries could be bought. And so for a lot of communities, that meant that the closest thing that was walking distance or accessible to people were gas stations and convenience stores, right? And so you go to those stores, and on the windows, on the doors, there are posters from um, companies that sell nicotine products, whether it's pouches, vaping, cigarettes, covering the doors, covering the windows. And then when you get up to the counter, a lot of the containers that hold cigarettes are facing down or at eye level, and not eye level necessarily of adult, but also the eye level of a child as well, right? And so curiosity can be piqued from that too. At a lot of the LGBT QIA plus events, like Pride across the country, some of those are heavily funded and sponsored by nicotine um, companies, and the same goes for companies that sell alcohol as well. And so a lot of that intentional marketing again, um, lots of marketing around menthol. Uh, uh, Menthol containing products are popular in Black and Brown communities due to previously discriminatory marketing and campaigns like Project Scum. And so menthol is heavily focused. Menthol was not banned in a lot of the other products that were banned with flavors. Menthols were allowed to stay. Sleek devices that look cool by whatever cool standards are, might draw more youth and young adults in. Um, some of the ads that sexualize women that are using nicotine, whether that's cigarettes or vaping devices, can be seen on in stores and places where you can buy those devices or those nicotine products, and still being heavily marketed um, in cultural centric locations or inner cities or urban areas. Some of the associated risks with nicotine are addiction, tachycardia, hypertension. It's important that we use lay language regardless of the audience, and so say instead of tachycardia saying high heart rate, instead of hypertension high blood pressure, and so on and so forth. COPD, this is where I would say lung disease. Cancer, I would say lung cancer and other cancers. Um, Increased anxiety, some symptoms of depression, and neurocognitive effects, especially in youth, inability to pay attention, hard to focus, hard to complete tasks. Those are things that people might relate more with, and is the truth, but we're using lay terms instead of medical or academic terms to get those points across. Nicotine products, obviously cigarettes are the most known, especially with people over 10. Uh, so what those are: cigars and little cigars. Again, language is really important here. Some of the little cigars that are pretty popular are Black and Miles, for instance, or Swisher Sweets, right? Hookah, smokeless tobacco, those are things like Skoal, Copenhagen, snuff. Nicotine pouches, the one pretty popular right now is Zen, and that's sold in most places that sell any nicotine or tobacco products. uh, Heated tobacco, and then e-cigarettes or vapes or ends, which is electronic nicotine delivery systems or devices. Uh, be cognizant that it's so many other names. If I've asked people I've seen in practice before, what kind of nicotine do you use? He was like, I don't use any. I'm like, well, do you vape? He was like, ew, no. I'm like, well, do you jewel? Yes, I jewel, right? And so you have to be cognizant of how you word things, because a lot of things they think is gross, but they're also doing it too. But the language is just a little bit different. With some of the nicotine content, this is one of the things I share most because a lot of people that are using these products have no idea how advertisement has kind of duped them to believe one thing when it's something different. Maybe they're thinking about using or switching over, or they want to talk to their children or family or friend about their use. So just be cognizant of the products that are out there, how they're used, where they're sold, and especially the language that goes along with them. Uh, these two, heated tobacco. Um, this is one of the scarier ones for me. And I say that IQOS, which stands for I Quit Ordinary Smoking, this is a heated tobacco device. You have these things called tobacco sticks. It looks like a half cigarette that goes into the device and it heats it. When I've been in other countries here recently, I saw a lot of people using these devices more so than I've seen when I've been in America. But it's pretty scary because it's still, like they call them nicotine sticks or cigarette sticks, depending on where you are, that you stick into this device, and it's still filled with tobacco. Right, and so it's pretty scary, but it looks sleek, which means there might be some interest. And then ends, e-cigarettes, vapes, jewels, that a bunch of different names that folks are using, especially youth and young adults. These are pod-based devices, and these have a lot of nicotine. 23 to 59 milligrams of nicotine uh, per ml and devices, right? And again, while these are things that you can still purchase, you can also make these things online. You can also create your own nicotine juice at home to put in devices. And so while there's lots of information of the devices that are on the market, it's you can still access instructions to make your own, making it even more dangerous. As a clinician, some of the things that we should be aware of while we are serving this population is how we speak to them and the things that we ask them. So it's important, especially as a physician or a nurse, um, to screen all patients or clients for use, regardless of age. Be mindful of those groups of people that were targeted by discriminatory marketing. Again, that's people of global majority, youth and younger adults, the LGBTQIA plus community, folks with lower socioeconomic status, people experiencing houselessness. Be mindful of the language used especially when speaking to youth and young adults. You want to meet them where they are. You want to try to, remove whatever hierarchy is in the room. This is especially important if you are a clinician that is going into a school or non-healthcare area to speak about the importance of nicotine prevention. Talk about products beyond cigarettes and vaping, right? Um, it will help youth and young adults, yes, but it might help folks that have no idea, and including other clinicians. Discuss the risk factors associated with social determinants of health. So don't only focus on health outcomes as far as tachycardia, hypertension. You have to focus on all of it to be inclusive. Discuss options in the event that they do become, addicted to nicotine or begin to use nicotine. And so those are things like, counseling, the role of nicotine replacement therapy, um, any medications that might be available to them based on age or appropriateness, and then staying up to date on different products and devices being used. I would say that is the best tool to have in your back pocket. Before I left my role in the hospital, everybody on my team had cards, and some in the office, you could go in and say and see physical pictures of what they are. So if a patient or a client shares something with you, you can go down to look at it to make sure you are supplying them with the most up to date information. And finally, just some things to know if you are a pharmacist. Be prepared to explain the differences when asked, or be okay, with saying I don't know. Right? If someone is asking you a question about is this safe, or what is the difference between uh, heated tobacco and a vaping device, be okay with saying I don't know. It's power in saying I don't know versus pretending to know, right? Be able to explain how any prescribed NRT works or over counter NRT works, especially if they have told you that they know how to use it because they've used it before or somebody else has used it, right? Nicotine gum and lozenges are not used in the same way that gum and lozenges, are used separate from that. Be prepared to use motivation interviewing, specifically ORS, which is open-ended questions, affirmations, reflections, and summaries. If the patient talks about a negative experience when trying to use NRT or trying to quit in the past, based on their experience or the experience of someone they know. And then, similar to physicians and nurses, try your best to stay up to date on different products and devices being used. Some of the companies that sell medications to help combat nicotine addiction um, can provide flyers. There are many organizations that can provide flyers about different devices and types to be used that might help you when you are speaking to someone about um, not using nicotine or they're beginning their journey to quit. Thank you.